Okay, good evening to each and every one of you. Thank you all most sincerely, kindly for taking the time in watching, and we're so sorry for the delay. Okay, good evening to each and every one of you. Thank you all most sincerely, kindly for taking the time in watching. Who's got this on the echo? So sorry for the delay. Okay, good evening to each and every one of you. Thank you all most sincerely, kindly. Who's got this on the echo? Got this on the echo. So sorry for the delay. Good evening to each and every one of you. Thank you all most sincerely, kindly. Got this on the echo. Got this on the echo.
What's going
Good
on?
evening to each and every one of you. Thank you all. Who's got this? Got this on the echo. Got this on the echo. Check the tabs. Check the tabs. Good evening to each and every one of you. Thank you all. Who's got this? Got this on the echo. Got this on the echo. Check the tabs. Check the tabs. Who on earth was that? Who had that tab up?
It might have been me. I'm sorry.
In case the internet gets a bit dodgy, I need to open the door a bit.
Apologies, Foxy. It was on my other browser. I don't know why it was playing.
No, but I'm going to start once again. Good evening to each and every one of you. Thank you all for taking part in this very live stream of mine. And we are part 2 with the Mother and Son podcast. And initially, we were going to have my auntie as a guest, but my auntie is also a special guest, and my mother is obviously the main guest too, because obviously it's namely Mother and Son podcast, but we've got my auntie making an additional appearance too. So do say hello to my Auntie Rebecca.
Hi, everybody.
A part of my mother's large family and a family of all 7, but that's another story. And they're going to share some interesting things to you. So listen, Mum and Auntie Rebecca, what gave you the insight and the idea to start up what you've recently been pushing and trying to promote in recent times, the Pelvicity? Go ahead and share your insights, please.
So shall I go first? So as you know, I'm a pelvic health physiotherapist. I've been a physio for probably about 23 years now, and initially worked as a musculoskeletal physio. So that's the sort of dealing with the usual things like backs and hips and knees and that kind of problem. But over the last 15 years, I've specialised as a pelvic health physio, which is quite a niche area, but very much a valid area of physiotherapy. And so this is something that I've been doing for a very long time, and it's my absolute passion to help as many people as possible to improve their pelvic health. And so we were just talking one day, weren't we, Nay? We'd gone away for a weekend, and we're just talking with our other sister. And we were just talking about how great it would be to create something online for people to access to focus on their pelvic health. And a lot of people find it a really difficult topic to talk about. And hello, I can see all these lovely hellos coming up on the screen. So we were just talking about how lovely it would be to create something so that women could access it wherever they are, and men as well, wherever they might be. So, and we thought we could collaborate and join our specialities really to help as many people as possible. So me being a pelvic health physio, Naomi being functional medicine practitioner and nutritionist, our other sister being a health coach, and my friend and colleague who's a rehab physiotherapist. So we just got our heads together and just came up with the idea.
Now this is very interesting and very good answer to the insight. And have you got anything to say on this, Mum? Because Auntie Rebecca said her piece. Have you got a piece to share?
Yeah, I think a big problem that we discovered when we did our research on what's available for people when it comes to their pelvic health. Obviously, Rebecca knows a lot more about it than me because she actively works in that field. But there are long waiting lists for a lot of people. And I think another big problem is that people feel ashamed or embarrassed if they do have an issue with their pelvic health. And so when we're talking about pelvic health, if people aren't entirely sure what we're talking about here, we're talking about things like incontinence that women may get as they get older, or other pelvic problems. Becca, do you want to describe some of the sort of pelvic issues that you see on a day-to-day basis?
Yeah, absolutely. Yeah. So obviously we see so many people, and we know that 1 in 2 women will have problems related to their pelvic health. So as Naomi said, it could be problems with incontinence. So that might be leaking from the bladder, leaking urine from the bladder when we don't want to, I know, or leaking from the bowel, stool. That can also happen. Sometimes they might have something called a prolapse, which is where some of the pelvic organs can just slip out of their usual position and end up, creating problems in that pelvic cavity. People may have pelvic pain, so they may have pain issues. They may have problems with sexual function. There's lots of different complaints that people may come, and they may have more than one, at a time. So, but like I said, we know that 1 in 2 women will experience a problem like this in their lifetime. Typically, there's various reasons why this can happen. So it can be because of pregnancy and childbirth. That tends to be a kind of classic one, but it's not necessarily related to that. It can be related to, long-term issues with the bowel, such as long-term constipation or injuries, surgery, various issues can end up creating a bit of a problem there. And it's really, it's something that's, we don't want people to be embarrassed about talking about that. And although it is a sensitive topic, and it's always very sensitive when we're talking about things in that sort of intimate area, but it is a very common issue, and it's something that we really want to raise awareness of. And it is getting better out there. People are becoming more able to talk about it. But it's knowing that these conditions are there, knowing that you're not the only one with them, but also knowing that there's help available to actually help improve or correct these problems.
Oh, and Mukmia's got a question. I broke my tailbone years ago, and it causes me issues. Is there anything pelvic floor wise you can suggest?
Yes, interesting. Although we can't give sort of personalised advice, because we recommend if you're having any specific problems, then to consult with a specialist who can actually see you. But absolutely, tailbone injuries can affect the pelvic floor, because the pelvic floor is a group of muscles that run underneath us. So they sit within the base of the pelvis, and they run from your tailbone to your pubic bone at the front. And so if there's been an injury in that area, so it can absolutely affect how well those muscles can function.
Yeah.
And there's definitely things we can do about it as well. So.
And there's one question I wanted to highlight. Sorry to the mod. Are gut and pelvic problems related?
Yeah, absolutely. Oh, so Nate, you might know more about this. I'll go.
I was just going to talk about, because obviously I work in gut health, and what I see a lot of is people who have a dysbiosis or a complex dysbiosis, especially if there's a bacterial overgrowth. They can get a lot of urinary symptoms, like the need to, the feeling of they need to frequently urinate, and feeling like they've got UTIs a lot. So that, or urinary tract infections, I commonly see that in my practice.
And there's a question from Marcia Co, not Marcia Tom's, Marcia Co. I know a few Marcias. Does taking stool softeners cause bladder issues at night?
It shouldn't do, unless they cause you some kind of bloating. So sometimes if you've got any bowel bloating overnight or constipation, so it may be more the constipation that's causing the bladder issues at night. Sometimes that extra pressure from the bowel, because in reality, your bladder and bowel are squished into that small pelvic area. And if one is feeling quite bloated or full, that pressure on your bladder may cause some issues with the bladder. And quite often we see this where women or men need to get up in the night to go and empty their bladder due to pressure from what's going on with the bowel. So if someone came to me with a problem, either or with both, with a bowel and a bladder problem, I would want to sort the bowel problem out first, because often that tends to be the culprit usually for bladder issues as well. And then often when we sort the bowel problem out, the bladder problems tend to resolve themselves as well. But yeah, it could be a bit of a reaction to stool softeners, might be upsetting the bladder too.
Oh, and Pamela's got a question. My mod, do you have suggestions for travel for women who feel homebound by such issues? That's a bit more complex, but what would you two say?
I would say this is something that we see all the time, because for a lot of people that are experiencing pelvic health problems, their world just tends to get much smaller for them, in that it becomes really difficult to travel, to go away, to go out for a day. It's something that's on their radar the whole time. Where's the next loo? Where's how long is it going to be till I get there? What's going to happen when I get there? So it's a really tricky one, and it's something that we see a lot, and it can absolutely become a real problem. In terms of immediate things for travel, that's a tricky one to answer. I would say make sure bowels are as good as possible before you travel. And things that can irritate a bladder, for example, are certain fluids. So things that we drink, like coffee and tea, they're really common culprits for some people, not everybody, but for some people, coffee and tea can really irritate the bladder. And if you're going away and traveling and then you've had a couple of coffees before, that's potentially going to irritate your bladder or your bowel as well. So we would encourage definitely, avoiding any of those bladder irritants. Other irritants are things like fizzy drinks. So fizzy drinks, alcohol can be an irritant. Citrus fruit juices can also be a bit of an irritant. So we would say just try and avoid those. Stick to something plain, like just plain water when you're traveling if you can. Or decaf tea and coffee often tends to be a bit better. But they're the key things really, in terms of traveling.
And obviously there is help out there to improve your bladder and bowel function, and not a lot of people know that, and sometimes not a lot of even GPs know that, which is really shocking. You may go to your GP and say, look, I'm struggling with some urge incontinence or some kind of incontinence, and they may not actually know who to refer you to, but just so everyone is aware, sorry if you can hear my alerts going off on my other browser, just so you're aware that there are pelvic health physios, and they are amazing at what they do and get great results. So ask to be referred to a pelvic health physio, or alternatively you can do a program like Pelvicity, where we will be addressing a lot of the common issues that people may be experiencing.
Yeah, no, that makes perfect sense. And Sapper just said you ladies should do your own channel. Now, what would you two say on that, even though it's not health related?
I think we have technical issues, Rebecca.
Yeah, I'm not great with technology, as you might have noticed, Foxy.
I'm not either.
Well, Heather's got a problem, has got to share something, not problem, but shared something. After having sepsis, no, I know your sepsis troubles, Heather. I mean, you could have died from that easily. A young person, let alone your age, could have easily died of sepsis. Will I always be predisposed? Because Heather had sepsis in 2018.
So do you mean because you've had sepsis once, will you always be predisposed? Not necessarily, yeah. Heather. No, because you can really build up your immune system and just get stronger. So not necessarily, unless it's something inherently problematic like a neutropenia that's chronic. It's not necessarily something that you're always going to be suffering with.
Well, what happened to poor Heather was it affected her liver, the sepsis she had. I think you know the substantial, long-lasting liver damage it did. Because I opened up to you about it. Poor Heather. I mean, it's not nearly as bad as what my grandfather went through, heart attack wise, and that effect was really worse. And a few other things, like one of my best friends who had the stroke 15 years ago. I won't say who, but it's not nearly as bad as what they've gone through, what Heather had, but still very serious. But good question, Heather. Good question. Oh, McMeow. Do you think that doctors are finally starting to recognize that pelvic health can affect other areas and start including it with regular healthcare checkups?
I would love that to happen. I think they are getting better. They are definitely beginning to realize that we exist. I mean, like you said, Naomi, I have had patients come through and say, don't be ridiculous, physios don't do things like that. When they said, I'm seeing a pelvic health physio. But it is getting better for sure. And I think pelvic health absolutely can affect so many other things, because one of the key things that we're always being told to do is to exercise. And if you have problems with bladder leaking when you're exercising, for example, that's going to put you off exercising. And we all know the benefits of exercise for us. So, you know, on a kind of long-term scale, it can have those sort of far-reaching effects. But I think the message is getting out there now, which is great, because people are beginning to realize what we can do, what we can achieve, and you know, just really turn people's lives around. And I see it every day, you know, and it's often quite simple, some of the changes that can be made to help correct these problems. You know, it doesn't have to be complex. It's often, you know, you need to either see someone or speak to someone that understands what your symptoms might mean, and then we can then identify, well, actually, if you make these little changes, that can make a really, really big difference to pelvic health. And sometimes, you know, just buying a few more minutes to get to the loo, for example, because you've strengthened your pelvic floor, can make all the difference in the world to somebody. You know, so yeah, hopefully, I think words getting out there. People are more aware. A lot of doctors are aware, and we get so many referrals. I work within the NHS, but also privately, and there are so many referrals coming in day out, and a lot of those are from GPs. But it can absolutely have all sorts of problems. And there was actually a study, which I think we talked about Nay before, where somebody was looking at the impact of low back pain and pelvic health, and it was showing that 95% of people with low back pain, for example, will probably have a pelvic floor issue. That's what they found. 95% of women that had back pain also had an issue with their pelvic floor.
That's an extraordinary statistic, isn't it?
It's
Yeah,
a
really
very large statistic, as it so sounds.
Yeah. But it's, you know, it's definitely something I see, and I've seen, you know, people with hip pain, for example, and back pain, and abdominal pain, you know, various things, and it's often linked to the pelvic floor. So treating the pelvic floor can often help with a lot of issues. And it makes sense, really, when you think about it. The pelvis is there at the center of us, and our legs hang off it, and our torso, you know, it's at the bottom of our torso. It's just so key to so many different things, especially when you've got those daily functions of emptying your bladder and bowel, you know, a few times a day. It's really, really important that all works as well as it possibly can. So it's really, really key.
There was a really good question just now. I think it was someone talking about prolapse. I think that'd be a good one for Becca to answer.
I can't see the prolapse on. I need to scroll up. And but Pamela's got a question. Do you find dehydration can be an issue when limiting fluids in order to leave the house?
Yeah, 100%. Yeah, we would. And it makes sense, doesn't it? That, well, if I don't drink anything, then my bladder won't need to work and then it'll be fine. But actually it has the opposite effect. If you're dehydrated, one, it's not great for you generally, but also for your bladder, the urine becomes really concentrated. And when it's that concentrated inside your bladder just wants to get rid of it, and it can just make your bladder really twitchy and then just irritated, and actually give you that urge and feeling that you need to go even more than it would be if you'd had plenty to drink and that urine was quite diluted. So restricting fluids before going away isn't helpful usually. So definitely wouldn't do that. But also restricting fluids can lead to things like constipation as well, which, as we talked about earlier, can also have a negative impact on the bladder too.
Yes.
From Munchie.
Yeah, Munchie. I'm trying to find the Munchie. No, she's a nice lady, Munchie. She's a lady, by the way, not a. No, but there's a question from Train Boy Rail Enthusiast. Even though he's a rail enthusiast, he's got a question related to the topic. Can eating too much ham cause diseases? Well, it's not related to pelvic health, but my mother and my auntie may have the answer to your question, even though it's pelvic health related. But good question. Good question. Good question.
Lovely donation. Thank you. Can eating too much ham cause diseases? I think eating too much of anything can cause diseases, because you've got to make sure that you have a balanced diet. Make sure that you have a lot of plant foods in there as well.
Vegetables.
30
we eat
different
plenty of vegetables in the house every day, and we always have plenty of vegetables in the house every day.
We do, yeah. At least 30 different vegetables a week is what we recommend.
Here's the question. I've got the question. Munch, she said. I was diagnosed with prolapse of the bladder, bowel, and uterus. Can it self-heal? I haven't had issues with anything falling out. Sorry, guys, for several years now.
Oh, so I'm glad nothing's falling out. That's good to hear. Definitely, we can be diagnosed with these things, and sometimes they can tend to come and go a little bit. So sometimes it could be a bad episode with constipation or having just had a baby or something like that can sometimes cause those prolapses. Sometimes the body can heal to a point and improve things so that you don't feel it so much. What we do know is that we can't completely heal a prolapse. So often it's related to where things have been overstretched and things aren't just being as supported as we would like them to within that pelvic cavity. So although we can't usually completely cure it, we can certainly improve it. And so often, again, sometimes it will be about strengthening the pelvic floor. Sometimes it will be about a lot of things to avoid, one of the things we always say is, do not, whatever you do, strain on the toilet if you're having your bowels opened. If that's something you definitely want to avoid if you've got prolapse or at risk of prolapse. So don't strain. So we can give a lot of advice about how to manage it. It's really, really important that you keep things strong, but we don't want things becoming too tight or tense. So what we wouldn't want someone doing is constantly working their pelvic floor, because that's not helpful either. And this is where an assessment is helpful, because sometimes prolapses could be because things have got too tight in the pelvic floor. And it's quite hard for you to identify that yourself. It needs someone else to really help guide you through that. So although we can't heal it, sometimes it will spontaneously improve and just get better. I've had really interesting cases with prolapses where I always remember one case of someone that came to me. Her husband had been diagnosed with cancer, and suddenly she developed a prolapse, and it was almost like it was linked to grief, which was just the most unusual thing. Once he was cured and sorted, the prolapse disappeared. Which is really quite, I can't even work that one out, but often it is linked to emotion can have a big impact on things that happen in the pelvic floor as well. And so stress and things like that can cause that unwanted tension in the pelvic floor can also make things worse. But again, we would say go and see somebody, get assessed, see where you're at, because it's really, really hard to know that yourself, and then just see what you can be doing to help it. So to definitely prevent it from getting worse, but hopefully improve it as well.
Thank you, Auntie Rebecca. It's very well said, sentimental statement. Pamela's got a question. Do you find doctors can also be a tad embarrassed by the subject too?
Yeah, I think possibly they shouldn't be, really, because they're used to seeing all sorts, aren't they, and dealing with all sorts of issues. I think it's more a case of that it's just not something that they've considered, maybe, in terms of bringing it up. And again, there was another study that we were looking at which looked at women bringing it up to their doctors, raising the subject of pelvic health. And now you might remember the statistics because I can't remember, but it was something like 70% of women would not bring this up to their doctor, but if their doctor asked them about it, wait, do you remember that?
Find it, because it was a really interesting statistic.
Yeah, it was really interesting.
We're ready to hear the statistic, Mum. But it isn't many. But that's to be expected, yeah?
Sorry, Foxy, I didn't quite catch what you said.
No, I was just saying it'll be an interesting statistic, but it may surprise many, but that's to be expected here in the live. Yeah,
but I think what I took from that study, if you can't find it now, is that it was very much, doctors probably won't bring it up to you, they won't raise it. So, but it's really, really hard to bring it up, isn't it, when you're in that clinic room? And so, but if the doctor were to ask that patient, do you have any issues with your pelvic health? So many of them more would actually say, yes, I do have problems, so I think there's definitely some work to do to help just improve that awareness and just make it easier for people to bring it up. It is a hard thing to bring up initially, but hopefully things are getting better in that regard.
I've got some really interesting statistics here.
Okay, read them out, please.
Yeah, I haven't been able to find that one, Rebecca, but one in two falls are connected with urinary incontinence. And that comes from guys in St. Thomas's. Isn't that a shocking statistic? We all know how dangerous falls are in the elderly, and how even death can result from falls in the elderly, like quite frequently. And 1 in 2 falls are related to urinary incontinence. And that could be people rushing to get to the toilet at night and tripping over things, or just rushing in general. Becca, have you got any insights on the falls?
No, I don't know. I mean, I think a lot of it is, like you say, just sort of waking up half asleep, desperate for the loo. And then, and if you're slightly wobbly anyway, when you're half asleep, that's just even more of a risk factor, where people may then just sit. But also, a lot of people have sort of wooden floors or not, where potentially if they have leaked a bit on the way, then they're going to slip over in that. There's various risk factors around that. But yeah, and obviously that's a major cost to people's health, and financially, like the NHS as well, isn't it? Falls are have a huge financial and personal.
11,000 deaths from falls per year in the UK, so it's a huge number. And 150 million working days are lost each year due to poor women's health. 150 million.
Oh, that's bloody awful. That's a bloody high statistic.
Yeah.
Heather's got something here. Heather's got a question. Should you see your GP for pelvic issues? Can they help, or do you need a specialist?
So I would say the first place to go to is the GP. I think it's always good for your GP to be aware that there's an issue there, because it's not necessarily going to be related to the pelvic floor itself. It may be related to something else. And so you'd want to exclude that there's not something else going on. So for example, if you've got a urine infection, you definitely want to get that treated. And that's something that your GP can easily help with. So GP can refer you to a specialist as well. That might be a doctor, it might be someone like me, pelvic health physio. It depends what the problem is, really. But GP is a good place to start, and then they would then usually know who best to refer you to. Our service in the NHS that I work for, people can self-refer to our service, which is great, because then it does take out that middleman, and it means that people can come directly to us. But that's all very well as long as they know that we exist, so again, it's all about raising that awareness and making sure that people can know that there's help available for it. Excuse me.
That's a very good answer. Thank you for the well-shared answer, Auntie Rebecca. But Pamela's now got an important question. Her aunt tells her niece not to exercise on the trampoline because it will ruin her lady parts. Will bouncing harm pelvic health? Okay, you, Auntie Rebecca or Mum, if you've got the answer, please share.
So it won't cause a problem, but if you've got a problem, trampolining can be quite difficult. Bouncing is actually a really, really good exercise, and it's a good exercise. But one of the things that most people, honestly, it's probably the most common thing that people say to me when they come to clinic is, oh, I wouldn't want to jump on a trampoline, or because we know that if you've already got a problem, bouncing on a trampoline is not great for, it's going to probably cause you to leak if that's your problem. It can be difficult if someone's already got a problem, but it's not necessarily going to cause a problem, if you haven't got anything there in the first place. So we want everyone to be able to exercise whatever way they want, and that's the key. It's horrible that something like this can prevent someone from doing the exercise they want, whether that's lifting weights, whether that is trampolining, whether that's running, whether it's doing an exercise class at the gym, it's playing with the kids in the garden, it's whatever things you want to do. We know that pelvic health issues can really, really stop people from doing these things, and we want to find a way to make people be able to still do those things. So it's very rare that I'll say to someone, you must never do this, I would, but we might just say, well, actually, maybe not do that at the moment, let's work on this to get you to that goal of being able to do that ultimately. So we would always want to work with someone with their goals, where they want to be, what they want to be doing, and then improve it. Sometimes we do have to, kind of accept that there's certain things that our body doesn't like us to do. But we obviously want to do our absolute best to try and get people where they want to be as well. But yeah, trampolining won't cause it. So if you're enjoying trampolining at the moment, go ahead. If it doesn't cause you any problems, it's actually really good. But if you've got a problem, you may find that you feel a bit vulnerable on that trampoline. But again, there's lots that you can do to work on that to improve it.
Okay. Heather's got a question. Is surgery necessary for prolapse or diet and exercise? There's a question that we put on, but we forgot to answer. Yes, sorry, Auntie Rebecca, go ahead.
Yeah, so obviously surgery is something that can be done to help improve prolapse. And obviously as a physio, my goal is to try and prevent anyone needing to have surgery. So the NICE guidelines, which are sort of guidelines that are out there for all health professionals to follow, it's all based on proper research and evidence. They recommend that you would have 3 or 4 months of pelvic health physiotherapy before you would go and have or be considered for surgery. So that's so we would always say, well, actually try physio first. It might mean that you don't need to have surgery in an ideal world. That's what we're hoping for. But actually as well, if you do end up needing surgery, which sometimes people do, if you've done that prep work beforehand and built up your pelvic floor and learn all the right strategies to help prevent things from getting worse, if you do need surgery, then it's going to be way more successful because you've actually done the groundwork and actually made things much more stable anyway. So it's kind of a win-win, really, going for pelvic health physio.
I think statistics show that pelvic health physio will reduce the risk of surgery by about 50%, the need for surgery, by about 50%. So it's definitely worth trying for sure. And as Rebecca said, it will improve the outcome of the surgery anyway.
And it's important to know that it's not, it's not a quick fix. These things, when you're working on muscles, it takes time for things to change, but it's absolutely worth it. And that's why they say 3 to 4 months of pelvic physio. It can really start to make a difference. So it's worth sort of sticking with it. It's not something that's going to just happen overnight. It is, it does take real kind of dedication, really. And most people, if you've got a prolapse, you do want it to get better. So you'll put the work in. But it is really important that you allow it time to work as well.
No, it's very well shared, and that's a very good answer. Also, Maureen's asking a question. Can having an episiotomy at childhood cause pelvic problems later?
Yeah, it can. So an episiotomy is where they might make a cut when you're delivering your baby to make a bit more room for the baby to come out. And often that involves the pelvic floor muscles. So, and our bodies are great, they'll suture that back up and you'll heal and everything will usually feel fine afterwards. But sometimes the job of a scar is to hold everything together. And so actually, a scar initially will start off quite tight, where it's, like if you've had a scar, it often holds things really quite tight and taut. And actually, as we mentioned earlier, we don't want the floor to be too tense. I can hear an echo again. And we don't want the pelvic floor to feel too tense because that's really unhelpful as well. So actually, one thing that I often recommend to women is to make sure that they massage that scar after they've healed fully from an episiotomy. That usually takes at least sort of 8 weeks, usually after surgery, and then or after that cut, and then massaging it just helps that scar to just integrate better into those tissues there as it did before. But sometimes scars are great because they're, our body's really amazing at healing, but sometimes it's always going to be a scar. We're not going to get rid of that, but it can just sometimes be a little bit of a weak area. And so that's why we would want to work alongside mobilizing that scar, but also strengthening it as well.
And Heather's got another question. Oh my, Heather, you've got it with questions, but that's fine. This is what we're here for. Okay, Heather, your question. Can I ask you both, have you heard of dandelion root helping the colon? That's Heather's big question here. What would you two say?
Yeah, it's known for having lots of fiber, like the good type of the prebiotic fiber. So it can really help with constipation if that's a problem. It can help get things moving. So yeah, there's many things that can too, but yeah, it is known for that.
Thank you. And I nearly thought I had a question, but I'm just looking for more questions.
I can see that.
I completely relate. Well, I do have children, obviously, But I think a lot of mothers, we laugh about it. So, because our pelvic floor does get weakened through pregnancy and childbirth, and we tend to sort of like make a joke of it. Oh, I can't sneeze, or be careful if I go on a trampoline and things like that. But I will admit that I have struggled after having 4 children at times, especially in the first few years after the births. I remember going to an exercise class once and jumping up and down and being like, oh dear, I think I need to go home. It happens to so many people. And
I think one of the things Leah said, I'm sorry if I got this wrong, but I think Leah said that she hasn't had children yet. So again, it's something
Leah's nearly 50. Leah's nearly 50, so she wouldn't be able to have them now, sadly. But she could have had children, but never mind. I think she'd make a very good mother, Leah would. She's older than Mum, but she'd make a good mother because she's always very supportive to myself and the chat.
That's
but
lovely.
I think there's a silly side that her mother hoped for me to keep control of and said, you need to help me keep control of your daughter. Mike Marcy's got a question. Are probiotics good for pelvic issues? That's a question we've now got because we were waiting questions. We need to keep the questions going.
Sorry, can we answer that one in just a second? But just coming back to, sometimes we don't have to have had children to have pelvic floor issues. Sometimes it can be, like I said, it could be that we've had a long history with constipation problems, for example. That's something that's really common. Sometimes it can be that we do lots of exercise and we work the other muscles really, really well, and the pelvic floor gets left behind and doesn't quite know how to kind of keep up with the other muscles. So sometimes it can be related to other things other than just the pelvic floor weakness. It can often be, that other muscles are just a bit too overworking, and then that means the pelvic floor doesn't work quite so well.
And then we also need to bear in mind that when women's hormones change as they get older, that also causes further changes to the pelvic floor and can start causing issues as well, Becca, isn't that right?
Absolutely. And you may have kind of got away kind of scot-free quite happily, but sometimes, and I would say the bulk of the women, probably 70% of the people that I see are women that are going either perimenopausal or going through menopause or on the other side of menopause. Often it takes women years to come and see us. They might have had a problem for 10 years and they've never sought help for it, but they come and see us, so it might well be after menopause. But with the hormone changes that we get when we go through menopause or when our hormones are changing, estrogen is that hormone that tends to become depleted, or it will become depleted when we go through menopause. And estrogen is really, really important for the pelvic floor and the pelvic tissues in that area. There's a lot of estrogen receptors in that area, so around in the pelvic floor, bladder, etc. So when that becomes depleted, those issues suddenly raise their head and we end up with problems when nothing else may have changed other than that. And so it's really, and again, there are things that can be done about that. So obviously we want to try and keep things strong, and not just our pelvic floor, but our bodies in general. Our pelvic floor doesn't work on its own. It works alongside other muscle groups as well, like your buttocks, your gluteal muscles, your leg muscles, it impacts how we breathe, can impact our pelvic floor, so there's lots of different possible factors that can be involved in the pelvic floor not working as well as we want it to. So we want to be, I've gone off on a bit of a tangent now. So so definitely just hormones is, if you're doing everything right and it's still not getting better, sometimes it could be hormones. And the doctor can give you like local estrogen. So this is like either a little pessary or a cream that can be inserted into the vagina that actually then just helps to improve the quality of the tissues. And a lot of women find that actually that makes so much difference. So, and it's not that they've done anything wrong. It is literally just the way that their hormones have reacted. And actually just by having that can make a huge difference to people's pelvic health.
I think as a society, we need to stop thinking that leaking as we get older is just not a normal thing to expect to happen. And I think sometimes the adverts we see for like Tenor Lady, for example, was one brand, and as if it's just normal that you have to wear Tenor Lady as you get older. You don't have to. There's so much you can do to regain control back of your bladder.
Yeah. And Nana C, do you ladies have an opinion on vibration plates? One was told that they are good for osteosporosis, but not sure about pelvic issues.
I actually don't know too much about that. Do you, Becca?
I don't know an awful lot either. I know it can be really good for exercise generally. It can sometimes just enhance the exercise that you're doing, but I don't know specifically related to pelvic health. Yeah, not sure. Sorry, can't answer that one.
They are good for bones, but
No, but
I've gone on them before, and it makes the workout pretty hard, I have to say.
Hello to Ginger. Nice to see you. Ginger, it's slightly irrelevant to the topic, but thank you for asking what's my mother's secret to her beautiful skin. Also, juicing fresh papaya will do wonders for your colon. Slightly irrelevant regarding the question relating to her beautiful skin, but interesting thing you had to say talking about the juicing thing.
Thank you. I've told everybody before, it's vitamin C serum and retinol. That's it.
That's secret to beautiful skin or something else?
That's the skin. That's what I do with my skin anyway. Sometimes niacinamide as well.
And also genetics is another reason, because being born to a Jamaican father, that's going to do it.
Well, yes, hopefully.
Yes.
There was a question about probiotics earlier as well, and about that for pelvic health.
There's one point I've got here. Get knotted. I'm 58 post-menopause and still feel like I did 20 years ago, though less energy. One would expect that post-menopause, undoubtedly so. Now Heather's got something. Why is it that I never experienced menopause issues? No sweating, no heat. Is that common? You might have just been lucky, Heather. You might have just been lucky.
Yeah. A very small, I used to specifically work with people going through menopause, and a very small proportion will say exactly that. And you are really lucky. Most people do struggle.
Yeah, but some don't. Or some, but I mean, obviously Auntie Rebecca would be post-menopause, but wow, you're looking pretty bloody amazing. No, you're looking bloody amazing. Well, most don't know this, Auntie Rebecca, but if I may, do you mind if I say?
I don't mind at all, no.
Earlier this year, this lady, our guest, Auntie Rebecca, just turned 55 back in February, so good on you, Auntie Rebecca.
Thank you, Foxy. That's great.
If you don't mind me saying, you've got the skin, and you look better than most people in their 40s, if you don't mind. I've seen people in their 40s look older than what you currently look like. 55.
Thank you. Very kind of you.
Pleasure. Well, as Mum would sometimes say, black don't crack.
Very true. Very true. Just look up.
Oh, hello to Abby in Richmond, London, and her Cocker Spaniel Bella.
Thank you, Abby.
And she said you both look fabulous. Even Daniel's very surprised. Rebecca looks great for any age, but 55, she's like, wow.
Oh, thank you. I just came in for the compliments.
Well, hello, Victoria and Claude, and the pets. Sorry I didn't say hello, but thank you, says beautiful family.
Oh, that's lovely.
Nice lady. Victoria, I think she's Irish or Scottish, and I think she's Irish, who lives in France with a French husband, Claude. Nice lady. She's very supportive, particularly of you too, Mum. Supportive of both of us.
That's so nice.
And Pamela's now here's a real important and a very, very important relevant question to the topic we're talking about. Is there an age at which physiotherapy will no longer benefit someone struggling with pelvic health? Right, I think Auntie Rebecca knows that, or Mum knows that. Share your piece.
So age doesn't necessarily have to be a barrier, for sure. So I have patients that are in their 90s that come and see me and improve with pelvic health exercises or treatment. So there's not an age at all. Sometimes there are conditions that we know, much as I would love to be able to say that physio is going to solve every problem, sometimes we know that it won't, and sometimes they do need help from somebody else. But there's no age limit on it. We see people from where children can have problems with their pelvic health, but also and get better, and so can more elderly people as well. So no age limit, and you know, we where there's if there's a muscle there, and you know, and tissues that we can work on, then we can make a difference. And like I said, a lot of it is, it's not just about the pelvic floor. It is about all the lifestyle things. So like what Naomi does in terms of nutrition. So if someone's drinking 8 cups of coffee a day and, you know, they're getting problems with their bladder, well, that's quite an easy fix, you know, because we can kind of reduce that. So sometimes it will be other things as well as the pelvic floor that can be the issue. But ultimately, and that's why we take a kind of holistic view on it. It's very much looking at all the factors in someone's life that might be having an impact on it, and trying to just make some adjustments and modify things, whether that's exercise, what they're eating, what they're drinking, and their habits, you know, what they do every day that can make a big difference. So yeah, no age limit. And come back to probiotics, because I'm interested in that and knowing what you think, Nay, about because I recommend probiotics. Just that was a question that came up earlier. Sometimes if someone's got problems with let's say they get like recurrent thrush symptoms in the pelvic area, you know, in the vagina, or bacterial vaginosis, you know, those kind of conditions, often probiotics can be really helpful. And so that can be taken them orally, you know, or there are different things that can be inserted internally as well. So that's something that we do often recommend if someone's getting those recurrent infections, because often it can just be that there's a bit of a mismatch between the, you know, the bacteria that lives in that area. But what about you, Nay? What do you think about, you know, in terms of sort of bladder and bowel?
Yeah, I think, I saw that question pop up and I was hoped that we would stop on it, but we went past. But I think probiotics are really important because they're important for your general gut health. And if your gut is working efficiently, then you're less likely to have constipation issues, which cause bladder issues like you were talking about earlier, Rebecca. So, and with candida as well. So that would be what causes the sort of vaginal thrush and issues like that. If that is an issue for people, then there's also special diets that you should follow just so that you're not feeding that candida. So it's one thing replacing the beneficial microbiome, which we should do, but we also need to get rid of that candida, which can be tricky. But you can have certain diets. It's really important not to eat too much sugar or any sugar, actually, initially. But yes, probiotics definitely have a place in pelvic health for sure. It sort of indirectly.
Sorry, one of my viewers had to go. Goodbye for now, Avril. Avril had to scoot. Goodbye for now, love.
Nice to see you.
Avril was the one who I interviewed a couple of months ago. The nice looking lady.
Yes, she's
lovely. Pretty. She was in her mid-50s as well. May not look as young as Auntie Rebecca, but pretty, with the round face, blonde hair, blue eyes.
I remember her. Nice. She's very beautiful.
She reminds me of Julie Andrews, actually, if there's any way to describe her. Because the face shape, and I'm like, wow. Goodbye for now. We'll chat to you again another time. Goodbye for now, and happy anniversary with YouTubing. She just celebrated 1 year of YouTubing.
Oh, happy anniversary, Fifth and Grace.
Yes, and what's next? Pamela's now got an interesting question. Do you work with post-surgical patients working to be off a catheter, bladder training? A catheter.
Yeah, so we don't normally, where I work for a community trust or privately, so I don't usually get involved too much in that kind of thing. Usually that would be dealt with in the hospital. They would be do a trial without catheter, or a TWOC as they call it. So if someone's had a catheter in for a while, which obviously can just be a bit of an irritant to the bladder, they would, once they remove that catheter, they would need to make sure that someone can pass urine okay, basically. But often after they've had a catheter in, especially if it's been for quite a long time, they may have trouble with leaking from their bladder. So that's absolutely the sort of thing that we would get involved in to try and help get their continence back. Because obviously when someone's got a catheter in, it really depends how long it's been in, but the longer it's been in, the more sometimes the bladder gets used to not having to think about anything because it's just on free flow and coming through the catheter rather than actually, normally the bladder should store the urine, you see. So your bladder is a muscle. It should store the urine until you're ready to go. You know, it'll have a certain capacity that you can hold in that bladder. Now, when you have a catheter, it doesn't need to worry about storing it because it can just come straight out. And so sometimes that bladder does need retraining to get it to learn how to store urine again. And that can just sometimes be a bit of a gradual process, but that is the work that we would also do that work as well. But I don't see loads of people straight from surgery. Often they would get to us a bit further down the line. But yeah, that is something that we could certainly help with.
No, very good. No, very well shared point. Very, very well shared point. Denise got something. Many in the US will get a UTI from having a catheter.
Yeah, they are. They're known for doing that. I mean, it should all be a sterile procedure, but they do tend to, people can get UTIs from having them. It's quite common. The bladder doesn't like anything foreign being in it. And at the end of the day, a catheter is a foreign object and it's going to kind of set up a bit of a reaction to it sometimes. So yeah, it can be a bit of an issue for UTIs.
Heather, oh gosh, I'm sorry I didn't pay attention to that, Heather. As I mentioned, suffer with colon issues and diverticulitis. Why do I bloat? Can you suggest anything, please? Oh, Heather, that's bad luck. Right, have you got any answers to this?
Yeah, so bloating is usually, I mean, it can be really complex. It could be food sensitivities. It could be candida, a yeast infection in the gut. It could be a leaky gut. Where's Heather based, Foxy?
St. Catharines, Ontario, Canada.
Okay. There are some tests that you can do to identify exactly what is going on in the gut. So I can recommend something to you. So I'll send you a message later with details of the test.
Okay. Okay, that's a good answer. That's a good answer. Oh, sorry, no, Pamela's giving it. Oops, no. Can I help? Suzanne, hi, Suzanne. Hello, sorry I didn't acknowledge you. Can I help on catheter issues? My catheter been in since 2008. Lost most of your blood. Oh, my word. What would you two say on that?
I think that's, yeah, I'm not sure if Suzanne's saying that they can help with it. It sounds like they're used to having that catheter in for a long time. I think sometimes people do just have to have indwelling catheters because, let's say, if you've had surgery on your bladder or there's been a problem with the bladder and it isn't working as well as it should do or not working at all, then having a catheter can be an actual, a good option. Sometimes they can put a catheter in through the tummy, through the lower tummy, which then stays in permanently. And actually, that's often a really good solution for someone that's not able to use their bladder properly due to either surgery or other problems.
Yeah. And Heather's saying to mum, please tell me a visit to the UK will make me feel better. What would you say to that?
Always, because we'll meet up, Heather, and you can meet Foxy in person. Hopefully that will make you feel better.
No, it would be brilliant to meet Heather because Heather, it's on her bucket list to go to the UK.
Yeah, come over, Heather. It'd be lovely to meet you.
No, she's a nice lady. No, she's always been very nice to me the last 5 years that I've known her.
Oh, that's lovely. Yeah, Heather's a lovely.
No, brilliant friend. That's not a friend I take for granted.
Good.
Oh, to get knotted. We've seen. Oh no. That was get knotted talking to Heather. No, that was not a question for us. I thought that was a question. Pamela's making a good point. That's right. Oh, okay. You mentioned the name of program you've developed. Can you tell us more about it?
Sure, yes. So the program's called Pelvicity, and it's something we've been working on for the last year, where we decided to get our heads all together and come up with something that we thought people might find helpful to help with any problems related to pelvic health. As we said, a lot of women don't want to go and see their doctor about this problem. They don't want to see anybody about it. They'd rather just deal with this at home on their own. It can be used to complement someone that has had an assessment and they know their pelvic floor needs work, or it's really open to anyone with a pelvic floor issue. And it is a collaboration of pelvic health physio, rehab physio, which is kind of like the exercise, Pilates, that kind of thing, nutritional advice and health coaching. And this is something we've been working on over the last year, and just kind of in sort of final stages, aren't we, Naomi, of actually just kind of getting together the program in a way that we are happy with, really, that we think people might like and find useful. And so we are hoping for people to trial it actually and just give us some feedback on what they think, you know, whether they like it. Do they like the way it's been presented? Do they like the exercises? Is it easy to use? And then we can then just make any sort of adaptations or modifications based on some feedback that we get. So so that's kind of it in a nutshell. It's going to be kind of designed for people to really be able to sort of self-assess their problems as well and progress their way through the program and hopefully solve specific issues or just actually prevent issues in the future, which is what we want to really promote as well.
Yeah. So if anyone is interested, whether you have a current pelvic health issue, whether you don't have a pelvic health issue and you want to prevent one from happening, because we should all be looking at thinking ahead, because we know that with hormonal changes as we get older, even if you're only young, with hormonal changes as you get older, you could develop pelvic health problems. Or if you are someone who is really struggling with stress incontinence or urinary urgency or some symptom, then you know, we'd love you to trial. It's all free, obviously. We'd love you to trial Pelvicity and give us your feedback. And there'll be, I think there's a link. I don't know if that's been put out there. I can't see the chat, but
I put it in the description. But shall I put it in the live chat?
Yeah, pop it in the chats. Yeah, and so for you to just register your interest, because we're looking for people to trial it for us, and we would love to have your feedback for that. So. Wherever you are in the world as well, you can trial it. So we'll send you the link to log in.
Bella's got a question. Bella Rose in Texas. Does your program help people diagnosed with interstitial cystitis?
So interstitial cystitis is something that you would normally be under the care of a urologist for, who can help with treatments if that's been formally diagnosed. So they usually diagnose that by actually having a look inside the bladder. And with interstitial cystitis, they can see that there are areas in the bladder that are inflamed. There'll be patches within the bladder that then cause that irritation to the bladder, and often that causes real urgency or frequency. It's a really difficult condition. So they can offer, urologists can offer things like installations that can help calm that all down. Where physio can come into that is obviously we can't directly impact the bladder itself. Obviously there's advice around diet and fluids and that kind of thing can make a difference for sure. But often people with interstitial cystitis tend to have pelvic floors that tend to be overactive, and that can then, we now really call it bladder pain syndrome. So that's where the bladder's, you know, sort of set this problem off, and then it causes all sorts of other further reaching problems. So actually sometimes by working on helping to allow the pelvic floor to become in a more normalized state. So normally at rest, our pelvic floor shouldn't be doing an awful lot, you know, except for needing to jump in if we cough or sneeze or jump or move. You know, it kind of helps to stop us from leaking. It helps to support our pelvis. It helps to support those organs. You know, it has various roles, but it shouldn't really be doing a lot when we're just resting. But if it becomes overly tight, that can then start causing things like pain and actually irritate your bladder more. So physiotherapy, and actually our program does actually look at how to relax the pelvic floor. So there's a series of exercises that can work on how to let the pelvic floor go, how to mobilize that pelvic floor in a way that helps it to let go and relax. And we've got some sort of tips in the program on how you can kind of identify whether your pelvic floor is likely to be more on the tighter side or just genuinely a weak pelvic floor. So but usually that's what I would say. People with real urgency problems, frequency of the bladder, pelvic floor tends to be a bit overactive. We reckon that 60% of women will be more prone to having an overactive pelvic floor than a purely weak pelvic floor, which is interesting because a lot of people automatically assume the pelvic floor is just really weak. And although having an overly tight pelvic floor ultimately ends up being weak because it's already given too much. It's got nothing else to give. So when you need it to do something, it has nothing else to contribute. So it ends up being weak in that respect, but it's not actually weak in the true sense of a weak muscle. It's usually just overly tight. So yeah, could help with that. It won't cure the interstitial cystitis, but we can certainly help with some of the symptoms that gives.
Okay. Oh, and Denise just said she told her mum in one of my last lives that she's carnivore, but after you, mum, told Denise your thoughts, she added some fruits and vegetables, but no refined carbohydrates. She actually feels better overall. Wonderful hearing so, Denise, but surprised you're a carnivore. I'm certainly not a carnivore. I'm more pescatarian nowadays, but I do eat meat, but in limited amounts. But interesting. Right, Heather, do either of you believe my having endometriosis have anything to do with your colon issues?
Yeah, it could well do. We know that endometriosis can grow in places, particularly around the bowel. It does tend to affect. So it could. With endometriosis, it's a condition that causes inflammation, and it's tissue that's like the tissue that should be inside the womb, but it's tissue that grows of its own accord outside of the womb. And it often tends to be a bit linked to what our hormones are doing at the time, but it tends to be inflammatory, and it can cause a lot of pain and problems. And one of the reasons that does that is one with the inflammation, but also the fact that it can affect the bowel. Often it does tend to grow around the bowel in various places of the bowel. It can grow anywhere in the body, but often it tends to be, very much in that pelvic area and around the colon and the bowel. So yeah, it's something that we see a lot actually, that endometriosis can give people bowel problems and bladder problems.
Different perspective as well. If you have a leaky gut, Heather, and that can cause significant inflammation in the body, and so I think it could be linked in that way too. It's like, what is the root cause of the inflammation in your body? Endometriosis is an inflammatory condition. What is the root cause? And that often starts in the gut. So I think, looking at it from that perspective as well, I would be very surprised if they weren't linked. Most chronic disease starts in the gut. So, so I really do feel like you need an assessment for leaky gut.
Oh, Ginger, I'm okay, thank you. No, it's fine. I've grown up with science pretty much for a long time because my mother, who's got a science degree, I've grown up with knowing quite a bit about science on a certain field and area of it. So I'm fine. This is not a progressive overload of information about women or pelvic health, gut health, what have you. It's not a progressive overload. Thank you. I'm not too young for this. I can assure you I'm not too young for this.
You're coming to my university lectures in the womb, Foxy. So you because I was pregnant at university with you. So
that's true.
Years of this.
Yes, well, you were first pregnant with me nearly 25 years ago now.
I was. Wow.
When you were 22 and I came out just after your 23rd birthday.
Did.
And then here I am 24 years later. Oh, Refill's here. Refill from No Other Cat. Hello, I take Balaxton for pollen allergy. Oh, no, you got pollen allergies. Well, this is not related to pollen allergies, but it is, but we are sorry for your problems, Refill. Right, Aspie's got a question. Hi, Aspie. Sorry I've not acknowledged you. Should women who are diabetic do any special pelvic exercises since they're more prone to UTIs? Well, you're talking to a pre-diabetic here, Auntie Rebecca, and I had an uncle who went down with it last year, unfortunately. But fortunately, he took action, and I had a 35-pound weight loss from 182 pounds to initially 147 pounds. But he's gained weight 8 pounds last time I saw him. If you want to know, Mum, he's 155 pounds.
He might not want you to discuss this on YouTube, Foxy.
No, but I'll probably say one more thing, but I'm going to shut it up at that. He said he hopes to be 160 pounds, only of muscle, and that's it. But now shut this up. But Aspie's got a very important question, and what would you two answer to that, since we've got diabetes genetically in the family?
I don't think there's any particular pelvic exercises I would say you need to do if you're diabetic. I think I think it's just important just to be really looking after your pelvic health in general. So again, being really, obviously you have to be really careful with your diet. We know that sugar obviously is something that you would want to avoid, and that can just be really problematic for bladder issues. But not particularly pelvic exercises specifically because of that. I would want everyone to at least be aware of what their pelvic floor is doing, and I think that's the important thing. We want people to kind of be empowered to know what their own pelvic floor is doing and knowing what they need to do at the right time. So no particular special exercises, but I think it's always good to get everything in as good equilibrium as possible when it comes to your bladder and bowel, if you've got any other sort of long-term conditions, to get the best out of it.
Anne's got something to say. Hi, Anne. Hello, lovely Anne. Anne Campbell, I think she's Scotland, I think she is. Recently, I sometimes find it takes ages to start urinating. Is this an over-tight pelvic floor? Okay.
It could be, is the answer. So it could be where the pelvic floor is not letting go, because when we need to empty our bladder, our pelvic floor needs to relax to let the urine out, because part of the pelvic floor forms a ring around the opening where we would normally pass urine through. So if that pelvic floor is overly tight, it could be that it's just not relaxing enough to let you go. And this should be an automatic thing that happens when your brain recognizes that you're in the toilet and you've got a full bladder. Once you're sat on the toilet, the pelvic floor should relax and your bladder should contract. And it's that contraction of the bladder that really helps squeeze the urine out and enable you to go. So it could be related to the pelvic floor. Often I say, just while you're on the toilet, make sure you're sitting on the toilet and not hovering over the toilet. So it's often difficult if you're using a public loo that you don't want to sit on, but ideally you should be sitting. You should have your feet slightly wider apart and leaning forwards with your elbows on your knees. And then sometimes just taking a big breath into your belly actually can just help your pelvic floor to let go and relax. Sometimes it just needs a little bit longer. Sometimes it can be that you're not filling your bladder sufficiently to get a good contraction of your bladder. So sometimes it can be that, if there's only a little bit in your bladder, it's not going to give you a good contraction because there's not enough in there to stimulate that contraction. So just make sure you're not going too frequently to the toilet can also be helpful. There are other reasons why it can sometimes be a problem. And if anyone's experiencing that, I would always say it's a good idea to see the GP just to get that checked. And it might be useful to have a bladder scan to make sure that you're emptying the bladder properly, because if you're not emptying the bladder properly, then that can be a cause of urine infections as well. So I would say try that, making sure you're sitting properly, taking a breath in, making sure you're trying to let the pelvic floor just go. We definitely don't want you straining to try and empty your bladder, so you shouldn't be pushing. It should be an automatic thing that happens. But if that breath in doesn't help it to let go, sometimes just running a tap can be helpful. When you hear the sound of running water, that can sometimes stimulate the bladder to empty. Sometimes just sort of tickling the low back, just sort of like around your very low back, just above your bottom, just sort of like tickling that can sometimes help stimulate your bladder. Sometimes just tapping on your tummy can just help to stimulate your bladder, sort of low down in your tummy. But if none of those things help, then I would definitely say it's something I would want you to get checked with your GP and have a bladder scan to make sure that you're emptying your bladder properly.
Now Denise has got something to say. It's not a question, but she's referencing something out. I lifted cases of water and strained my pelvic floor. It was very painful and took months to heal. I wouldn't be surprised. I was told it was common for women to sustain injury to the pelvic region from lifting heavy objects. Well, it can depend on your strength. It depends on how much strength of muscle you've got. Well, I'm not muscle bear, but I have to watch what I do because there's only so much strength I've got. My mother would be the same, anyone's the same, so you could be in that category. But what would you, Mum or Auntie Rebecca, say on that, on Denise's ordeal when she had that some time ago?
Yeah, that sounds really painful. And yeah, it can be if we're lifting something heavy. Cases of water can be extremely heavy. Our general advice is to avoid lifting anything really heavy, making sure that you're using the correct techniques where possible. Sometimes things just have to be done though, don't they? And we have to lift things like shopping or children or, sometimes that's just something that we, need to do. But we would say if you can avoid lifting, I would always say to make sure that you're doing almost like your own little mini risk assessment of, do you have to lift that? Could you separate that package out into smaller packages so that you're not lifting one big heavy load? But obviously, if this has already happened and you've strained the pelvic floor, absolutely, it can take a bit of time to heal. Like any muscle, pull a muscle, we know that can take months to get better. And because of the pelvic floor where it is, it's actually quite difficult to really, target sometimes. So obviously that's stuff we can do, but it's hard for you to do it yourself. So heavy lifting, people, we encourage people to lift because we want you to be strong. And what's really important if we're lifting something is actually we've got strong arms, because actually we want the load to be taken through our arms rather than transferring through our body and down into the pelvic floor. So again, another plus exercise, it's another plus for keeping strong, keeping your whole body strong, because we know, if your arms can take that load, that's less going through and creating that pressure down into the pelvic floor. So, but yeah, very, very heavy lifting. And again, it depends what you're used to doing and how you've trained your body and the techniques and lots of other things. But ideally, avoid anything too heavy. But if that's what you do as a exercise, with any kind of weight training, you want to progress it gradually and build it gradually and see how your body responds. But yeah, we do have to be careful with lifting, particularly at certain times. So for some women that might be, obviously if someone's just had a baby, we would definitely say, you just want to be particularly careful around lifting around that time. Or if you've had surgery, or if you've got a weak pelvic floor, you want to be careful. But like I said, there's always stuff that can be done. We want to build you up to be able to do whatever it is you want to be able to do or have to do. Sometimes jobs do require that they involve some lifting, and we want people to be able to live their lives in the way that they need to. Yeah.
Nana C's now got a question. Will you be doing a live show on gut health, dietary help, and so on? One has gave causing bleeds within the stomach, vomiting blood and having blood in stools, anemia, if diet could help.
Yeah, I'm really happy to do a live on gut health, but your condition is really rare and it's definitely not something I'm a specialist in. I know a bit about it. I know it's a vascular issue, but it's not something that I routinely deal with. So, but I could give you general advice on improving your general gut health, but I don't know how helpful I would be, and just being honest with you, with regards to this condition. But diet can always help everyone by improving your nutrition. So it doesn't mean that you're going to get a cure, but it will certainly help you feel a bit better. But yeah, I'm really sorry, Nana C, I'm not an expert in it.
Oh, no trouble. Certainly no trouble. Okay, Pamela. Right, now I've got a question from Pamela. Thanks to the mod for highlighting this. Is the term pelvic health a new one? I've not heard it before. I think it will be ready. It will really help people to discuss their issues with less embarrassment.
Yeah, it's great. I love it. It's so much better than what we used to be. We used to be called sort of like bladder and bowel physios or women's health physios. And obviously, it's not just women that have these problems. So it encompasses things much better. It's been more of a change over the last, probably maybe 5 years. It is quite recent. You're right. It is quite new. And I think there were just a lot of us pelvic health physios that were like, well, actually, it doesn't really describe everything we do. We're not just women's health physios. That was the classic one. We're not just urogynae, because that just sounds, again, like it's just women. We cover all genders. We can help everyone with all sorts of problems. And so pelvic health covers everything, so it's definitely a much better term, and it does sound a bit less it just feels a little bit nicer to use, doesn't it, than just talking about bladders and bowels. So yeah, it is quite new, you're right, and it's just something that just seems to have just sort of like caught on, and now that seems to be the standard. That's what we all call ourselves now in pelvic health. And so yeah, I'm glad for the change. It's definitely a lot better.
Yeah, it's a great observation. I hadn't even really noticed, because I remember you always used to be a urogynae physio, didn't you? Yeah.
That's right, yeah. Or a women's health physio, it was always called. But, you know, I treat men, women, and, you know, any gender. So it's something that's, you know, definitely a bit more inclusive, I think, which is what we all want to aim towards.
Yeah. Heather's in agreement that we need a gut health live chat. Seems to be a huge issue. Yeah. But would you like to appear on the live, Heather, if we did a gut health live? Would you like to appear on it? I mean, even though I know what you look like.
Oh, it's Foxy frozen.
Foxy's frozen. Doesn't have the best internet in his room. But yeah, it's a huge issue, Heather. It really is. I talk to people all day about their gut health, and so many people are struggling and not getting the answers they need from traditional medicine. So I'll be very happy to do a live on gut health.
No, I'd be happy to do gut health too. I'd join in, but obviously I'd need mod to highlight questions, certain points shared. I'm up for it. Sorry, no, I needed to reply to someone. Now, have we got any final 2 questions? Because we've gone on well over an hour, so we can have 1 or 2 questions and then we need to finish things off, because we normally do about 1 hour or slightly over. But any 1 or 2 questions, everybody, and then I'm going to ask the final question, and then we're going to finish things off respectfully and kindly.
Perfect. Yes, Sling the Mesh. I have heard of Sling the Mesh. This is a group that was set up to support women that have been mesh injured. So when they've had mesh inserted usually for sort of continence issues into the pelvic area, and that mesh has caused some trauma to the tissues or some damage, and so they have fought long and hard to get justice for women that have had problems related to that mesh. So yes, I have heard of them.
Interesting.
Yeah. You're right, Pamela. Gut health can really affect mood as well.
Yeah, bad.
So 80 to 90% of the neurotransmitters that we need for mood are made in the gut. So if you have issues with your gut health, you can have issues with producing the right amount of neurotransmitters, and that will influence your mood. And also other things like if you have something called LPS, which is a toxic waste product that can occur with gut problems, that can cause depression, anxiety. But yes, having like serotonin is made in the gut. GABA is made in the gut. So it's all really important neurotransmitters so we need a healthy gut to feel mentally well as physically well.
Okay. Maureen saying, my dear late father referred to such things as ladies' problems. I'm glad we have come a long way since then, you know, only unimaginably so.
Yeah, it's so true. We have come a long way. It's fine to talk about these things, and it's not something to be ashamed of.
Exactly. Suzanne, I had a Monac sling fitted after a spine operation. I was lucky. It worked for me with no issues. I'm pleased for you, Suzanne. I mean, we're pleased for you. But one more question from anyone, and then after that, I'm going to ask the final question, and then we're going to finish off. Any more question? One more question from all. Oh, that's the last question. Then we're wrapping up questions after Stevie's question. Do you recommend sauerkraut? I eat that.
Yeah, absolutely. As long as you don't have candida or any kind of histamine intolerance, sauerkraut's great. I love sauerkraut. A lot of people don't love it, but you can just add like a spoonful on the side of every dinner, and it's just a really great way of getting really healthy bacteria into the gut. It's lots of fermented foods, just really good for that. Things like kimchi as well.
Thank you for the disclaimer, Pamela. Thank you for the disclaimer. And Munchie, thank you for your kindness. Susan, hello. No trouble at all. It will be watchable on replay. No trouble at all. Don't worry about lateness. Oh, sorry. Oh, thank you, Alice. Thank you, my lovely friend. Thank you. one more question. What are your I mean, you've given a few attempts, as I know it's true you gave a few attempts to really promote pelvic health, but what are further future plans for the Pelvicity business, you two, if I may so share it out with the chat?
Well, first step is to get a trial going. So if anybody would love to trial it, then please fill in the form on the link that we provided. You'd be very welcome. We'll send you a login so that you can actually go through the program yourself. We'd love to have your feedback. And then after that, once we've got all that data from the trial, we'll be putting it out there to well, we're looking to really put that out there to corporations for their staff and employee benefits and things like that. So so it's not necessarily going to be something that's available to the public, as in for you to just buy it, but it's it may possibly be, but we're looking to put it out there to help people, because a lot of people just don't have access to this, or they don't feel they have access to it, or don't know anything about it. So it's going to be something you can do in your own home, in the privacy of your own home.
Okay, no, that's a very good answer. No, really, thank you, Mum and Auntie Rebecca, for promoting the Pelvicity. I wanted to say I did put the link to the website in the chat, and also for those of you who want to who are going to watch this on replay, I mean, the edit came about 5-10 minutes before the live started. If you refresh and come off and then go and watch replay, I put the link to the website in the description below, alongside other 2 links, which will be the original Mother and Son live we did last year, and the part 1 of the anniversary special, which Auntie Rebecca was going to come, and it was originally just going to be 1 live, but Auntie Rebecca had circumstances which curtailed her from going. But no trouble, she made the second part. So part 1 of the anniversary is in the description. The original from last year's in the description. I think, Auntie Rebecca, I'll send you a link to the replay to the original for whenever you want to watch it. And the Pelvicity website link is in the description to this live stream replay. So thank you all most sincerely, kindly for watching, and thank you for the nice things you had to say about my mother as usual. My mother, I mean, I'm getting a lot from my mother, a lot of things said about my mother, especially when one's saying that my mother's beautiful. And to the cronies who are saying absolute shit about my mother, fuck you. That's another thing. Sorry about that. But yes, it's true. We've
I'd love to see them.
Not had any cronies, no trolls. That's good, and it's been brilliant. But the cronies will likely be watching in the background, so screw them. Excuse that. Thank you all most sincerely, kindly for watching. But Auntie Rebecca and Mum, thank you for the fun, and thank you for the good live. You promoted something very good and extremely useful, and really something that seriously needs to be highlighted, and should be highlighted with no shame. Like you said, it should be highlighted and promoted with no shame and no regrets, no guilt whatsoever. So thank you both for that and emphasizing this philosophy. Thank you.
Thanks for having us, Foxy. Thank you so much. And thanks everyone.
Oh yeah, thanks so much for having me on the show. It's been brilliant. I've loved it. And yeah, thanks for all the questions as well. It's really great to hear that people are so interested in this topic.
Yeah.
Yes, and thank you, Auntie Rebecca. Please don't worry if you couldn't make it a couple of months last month, but we're happy we've had you this time. And this now concludes the anniversary special of Mother and Son Live. And I've always enjoyed the Mother and Son lives. Goodbye all for now.
Bye. Thanks.
Bye. Bye.
Thank you always.